Hi, my name is Max Soto, and I'm a senior athletic training student at Texas Lutheran University. And today we're going to be discussing routes of administration and the first pass effect. Let's go ahead and get started. So the different types of major classifications of administrations are enteral, parenteral, respiratory, and topical. Enteral is oral ingestion, which is the most commonly selected, safest, and convenient form of drug. It can come in the form of a solution, a capsule, or a tablet, so like in this corner. When oral drugs are ingested, it is absorbed through several areas of the gastrointestinal or GI tract, and they're easily absorbed into the small intestine because of such a large surface area and the alkaline pH levels. Examples of enteral drugs are ibuprofen, which is common and probably a drug that you've already taken, and then nitroglycerin, which can be used to treat and prevent angina. The next one we're going to talk about is parenteral, a drug given through a non-oral route, typically by injection. This route is easiest because it's able to reach the site. The drug is able to reach the site more directly. The route includes a subcutaneous, an intramuscular, intravenous, intrathecal, and an intraarticular. An example of this is a corticosteroid that's usually administered intraarticularly. And in this chart, you can go ahead and see that depending on the area that you're trying to target, there's different needle depths that'll target the area easier. Moving forward, the next one we're talking about is respiratory drugs that are administered in the form of gases or fine mists. They are effective in absorbing and transporting medications into the bloodstream rapidly because the lungs have, again, a large surface area and such a rich blood supply. A more common example is albuterol, which is used in the treatment of asthma. The last one that we're going to talk about today is topical drugs that are applied to the skin or the mucous membrane. Because of the epidermis, drug absorption is difficult for topicals, and so they're more used towards skin problems, skin treatments. A topical drug can come in the form of ointments, creams, and a transdermal patch. A popular topical transdermal drug is nicotine patches, and you see them mostly used with patients who are trying to stray away from using any kind of tobacco products or any tobacco usage. Okay, so now that we know about the routes of drug administrations and have a general idea of how they get absorbed through our body, let's go ahead and talk about first pass metabolism, or first pass effect is how I'll be talking about it in this video. So first pass effect is described as a process by which a drug is ingested orally and then absorbed from the GI tract into the portal venous system. So a little background on portal venous system, it's the vessels that help drain the capillary beds of the GI tract or the spleen and into the capillary beds of the liver. So when the drug is first ingested, it first has to go in through the liver, and then it's able to reach the general systemic circulation and go out into the body and find where it needs to go and what site it has to reach. When the drug passes the liver, however, there is a problem. The amount of drug is decreased significantly from when it was first ingested orally. And this means that once it finally reaches the site in the body that it's trying to target, the amount of active drug is decreased significantly. So you don't really get as much to the site as you think you do when you orally administer a drug. The best way for us to get around the first pass effect is two ways. We have the parenteral drug administration, so that's your injections, subcutaneously, intramuscular, all those that we touched on earlier, and by the sublingual route, which basically means you put the drug, like in this picture, right under your tongue, and the drug dissolves into the saliva and is able to reach the systemic circulation quicker and easier. So in the grand scheme of things, what does this mean for clinicians? First off, understanding the way drugs is absorbed is super important to us because Some drugs do benefit from going through the liver, so we want to understand what drugs do and how that works for us and our patients. It also helps us in finding the most beneficial and quickest way to target the site for our athlete. So treating the athlete is a case-to-case basis, as we know. And let's throw in an example. Let's make this easier. For example, you wouldn't target a superficial dermatological problem through an oral drug when you can instead use a topical treatment that works at the site directly and quickly, and it's more effective. Another example, which well, a couple of us will have asthmatic patients. So when you're dealing with a patient that has asthma, you want to fix their problem quickly and effectively, and the best way would be with albuterol through their inhaler. Again, you wouldn't want to just give them an oral treatment or something that won't directly target quickly or effectively. Um, the better understanding that we as clinicians have on the first pass effect of drug administration, the more success that we'll see in treating our patients, because of course the most important thing is that we have great patient care. So that is all for today. That's a wrap. Thank you, and we'll see you next time. Bye.